My name's Kelly Hale, and I've created this video for the first International Diastasis Recti Awareness Day. This day was created by the Center for Women's Fitness to increase awareness and understanding of a diastasis, and also to help connect people to resources to help learn how to heal this situation as well as prevent the situation. I'm an occupational therapist and a Pilates practitioner, and I've had the honor of serving many people as they rehab a diastasis recti, both women and men, and also I have the joy of helping to inspire and educate other healthcare providers and fitness wellness practitioners towards healing the situation, which is so possible. Now, I did say women and men get a diastasis recti, and some of you may know of a diastasis recti primarily from women getting them during pregnancy. And yes, that can happen during pregnancy, even labor and delivery, even during a C-section. But men can also get a diastasis recti from improper lifting techniques, poor biomechanics, imbalanced musculature in their trunk area. Now, at this point, you may be asking, what is a diastasis recti? It's an actual separation of the fascia and musculature at the rectus abdominis sheath. And the separation typically starts at the belly button, but it can go up or down from there. Now, this can be prevented, and one of the best ways to prevent it during pregnancy is to avoid flexion or bending forward in the spine. So positions like an abdominal crunch would be a position to avoid during pregnancy. And it can also be created because of subsequent pregnancies and the imbalance in the trunk structure. It can be poor lifting techniques. And again, on a second or third pregnancy, you could have a person, a woman, lifting a child that's a toddler while also being pregnant, and that could set her up for a diastasis. Now, there's lots of ways to prevent it, but today I also want to talk about how you could start to help heal this situation. One of the things you want to think about when you're working on healing this situation is you want to avoid going into that flexed position because it's going to further the separation. Now, if you're someone who suspects you may have a separation but you're not sure, make sure to work with a qualified health and wellness professional, especially someone trained from the Center for Women's Fitness, as they can help you detect if you have one. I've always felt that it's a crime that women don't get rehab postnatally to help bring their structures back together and heal the structures after the intense 9 months of pregnancy and the intense marathon of labor and delivery. So again, you want to avoid flexing forward positions as that can really exacerbate the situation. One thing that I would start with is just bringing awareness to the pelvis. So I have my trusty hound dog here. Sitting on a ball, you can just start with some gentle pelvic tilts. Doing the pelvic tilts forward and backward helps to contract and release the pelvic floor. And then bring in a neutral position. So that means you're honoring the lumbar curve that curves in naturally, and the curvature neck, the lordosis at the cervical spine, you're also honoring that, and you're allowing the mid-spine, the thoracic spine, to take its natural outward curve. Now in this position, we can start to bring awareness, first of all, to our pelvic floor. I'd like you to visualize the two bones that you're sitting upon, your ischial tuberosities or sits bones, your pubic bone and your tailbone. And as you inhale, visualize stretching those four bones apart and the musculature in between them. And as you exhale, bring those four bones together. And as you do that, you might start to feel some movement or contraction underneath the low belly area. So again, deep breath in, visualize the 4 points stretching apart as they naturally do, and then exhale, draw those 4 points together. Just a side note, have you ever wondered why women are educated to exhale when they're trying to push the baby out? Really, they should be inhaling on that portion of delivery because that's when the body naturally opens the pelvic floor. But back to the diastasis recti. So working on healing the separation, if you bring your hands here and bring some awareness, deep breath in, and big exhale, think of drawing that tissue together and your hands start to overlap. Now if you have one, you'll know if it's more above the belly button or more beneath the belly button, so you can focus your hand placement in either of those positions. Deep breath in, exhale, feel like you're approximating or drawing together that abdominal tissue. Now you can do that also with a towel, and I'll show you in the next video how to do that lying down on the floor with the towel. So I hope this was a chance for you to start to get informed about the diastasis recti, and please feel free to share with friends and family that might be interested in this. And if you're interested in further education and training, check out the courses at the Center for Women's Fitness.